Alright guys, before you skip this video, let me ask you something. You're doing everything right. You're taking your blood pressure medication like your doctor told you. You're trying to stay healthy. But now, there's a new problem in the bedroom, and nobody's talking about it. Here's the reality. Studies show that up to 70% of men taking blood pressure medication experience some form of erectile dysfunction. 70%. That's 7 out of 10 guys dealing with this frustrating, embarrassing situation, and most of them think they just have to live with it. Well, I'm here to tell you today that's absolutely not true. There are real, proven solutions, and I'm going to walk you through every single one of them in the next 15 minutes. So if you've been struggling with this, or if you're worried it might happen to you, stay with me. This could change everything. What's going on, everyone? I'm Dr. Mike, a board-certified urologist helping men reclaim their confidence and their health. And today, we're diving deep into one of the most common questions I get in my practice. Can blood pressure medication actually cause erectile dysfunction? The short answer is yes. But here's the good news. We have solutions. Real, effective, urologist-approved strategies that can help you maintain healthy blood pressure and a healthy sex life at the same time. Here's what we're covering today. First, I'm going to explain exactly how high blood pressure and certain medications interfere with your ability to get and maintain an erection. We're talking about the actual science, but I promise to keep it simple. Then, we'll discuss which blood pressure medications are the biggest culprits and which ones are much safer alternatives. After that, I'm going to share 5 powerful treatment options that urologists use every day to help men overcome medication-related erectile dysfunction. And finally, we'll talk about lifestyle changes that can supercharge your results and maybe even help you reduce your blood pressure medication dosage over time. So grab a pen, take some notes, and let's get into it. Let's start with the basics. Why does blood pressure medication cause erectile dysfunction in the first place? To understand this, you need to know how erections actually work. And guys, it's all about blood flow. When you're aroused, your brain sends signals to the blood vessels in your penis. These vessels relax and widen, allowing blood to rush in and fill the spongy tissue inside. That's what creates firmness. Simple as that. Blood flow in, pressure builds up, erection happens. Now here's where high blood pressure enters the picture. When you have hypertension, your blood vessels are constantly under pressure. Over time, this damages the delicate lining of those vessels, making them stiff and narrow. Think of it like a garden hose that's been left out in the sun too long. It gets rigid, cracks form, and water doesn't flow as well anymore. The same thing happens in your body, including the blood vessels that supply your penis. So even before medication enters the equation, high blood pressure itself can make it harder to achieve strong erections. But then we add medication to the mix, and for some guys, things get worse. Not all blood pressure medications cause erectile dysfunction, but certain types definitely can. Let me break down the main offenders for you. First up, diuretics. You might know these as water pills. Common names include hydrochlorothiazide and chlorthalidone. Doctors prescribe these to help your body get rid of excess sodium and water, which lowers blood volume and reduces pressure on your artery walls. Sounds great, right? But here's the catch. Diuretics can decrease blood flow to the penis. They can also reduce zinc levels in your body, and zinc is crucial for testosterone production. Lower testosterone often means lower sex drive and weaker erections, so it's a double hit. Next, we have beta blockers. These medications like metoprolol, atenolol, and propranolol work by slowing down your heart rate and reducing the force of your heartbeat. Again, this lowers blood pressure. But beta blockers also interfere with the nerve signals that trigger erections. They can make it harder for those blood vessels in your penis to relax and open up. Some guys describe it as feeling disconnected or unresponsive, even when they're mentally aroused. And just like diuretics, certain beta blockers can also lower testosterone levels, compounding the problem. Now, I don't want you to panic if you're taking one of these medications. Remember, high blood pressure is serious. It increases your risk of heart attack, stroke, kidney failure, and a whole host of other problems, so you absolutely need to manage it. But here's what a lot of doctors don't tell you. There are alternative blood pressure medications that are much less likely to cause erectile dysfunction. And switching to one of these alternatives might solve your problem without sacrificing your cardiovascular health. Let me tell you about the safer options. First, we have ACE inhibitors. These include medications like lisinopril, enalapril, and ramipril. ACE inhibitors work by relaxing blood vessels, which lowers blood pressure without negatively impacting blood flow to the penis. In fact, some studies suggest they might actually improve erectile function by enhancing overall circulation. Then we have ARBs, which stands for angiotensin receptor blockers. Think losartan, valsartan, and telmisartan. These work similarly to ACE inhibitors and have an excellent track record when it comes to preserving sexual function. Many urologists, including myself, consider ARBs one of the best first-line options for men who are concerned about erectile dysfunction. Another great choice is calcium channel blockers like amlodipine and diltiazem. These medications relax the muscles in your blood vessel walls, improving blood flow throughout your body, including to your penis. They're generally well tolerated and rarely cause sexual side effects. So if you're currently on a diuretic or beta blocker and you're experiencing erectile dysfunction, it's definitely worth having a conversation with your doctor about switching to one of these alternatives. And guys, this is important. Never, ever stop taking your blood pressure medication without talking to your doctor first. Suddenly stopping can cause a dangerous spike in your blood pressure. Always make changes under medical supervision. Now let's talk solutions. Even if you can't switch medications, or even if switching doesn't completely solve the problem, there are powerful treatments available. Let me walk you through 5 options that urologists use every day to help men overcome medication-related erectile dysfunction. Solution number 1. PDE5 inhibitors. These are medications like Viagra, Cialis, Levitra, and their generic versions, sildenafil, tadalafil, and vardenafil. You've probably heard of these. They're the most well-known erectile dysfunction treatments out there. Here's how they work. When you're aroused, your body releases a chemical called nitric oxide, which helps blood vessels relax. PDE5 inhibitors enhance this effect by blocking an enzyme that would normally break down nitric oxide. The result is stronger, more sustained blood flow to the penis. And here's the key point. These medications work really well for men whose erectile dysfunction is caused by blood pressure medication. In fact, studies show success rates of 70 to 80% or higher. Now, I know some of you are worried about taking these medications if you're already on blood pressure drugs. You're thinking, won't that cause my blood pressure to drop too low? It's a valid concern, but here's the reality. For most men, PDE5 inhibitors are perfectly safe to take alongside blood pressure medication. They can cause a small temporary drop in blood pressure, but it's usually not significant. The one major exception is if you're taking nitrates for chest pain, like nitroglycerin. Combining PDE5 inhibitors with nitrates can cause a dangerous drop in blood pressure, so that's an absolute no-go. But for the vast majority of men on standard blood pressure meds, these erectile dysfunction treatments are safe and effective. Of course, you should always check with your doctor first, but don't let fear hold you back from exploring this option. Solution number 2. Check your testosterone levels. This is something a lot of guys overlook, but it's crucial. As I mentioned earlier, some blood pressure medications can lower testosterone. And even if your medication isn't directly causing low testosterone, the condition itself becomes more common as men age. Low testosterone doesn't just affect your sex drive. It can also make it harder to achieve and maintain erections, reduce your energy levels, and even contribute to depression and anxiety. The good news is that testosterone deficiency is treatable. If blood work shows your levels are low, your doctor might recommend testosterone replacement therapy. This could be in the form of injections, gels, patches, or pellets. Many men experience dramatic improvements in erectile function, energy, and overall quality of life once their testosterone levels are optimized. But here's the catch. You need to get tested. Don't just assume your testosterone is fine. Ask your doctor for a blood test, and make sure it's done in the morning when testosterone levels are naturally highest. Solution number 3. Vacuum erection devices. Now I know what you're thinking. These sound old-fashioned or embarrassing, but guys, vacuum pumps are actually a highly effective non-invasive treatment for erectile dysfunction. Here's how they work. You place a cylinder over your penis and use a manual or battery-powered pump to create a vacuum. This vacuum draws blood into the penis, creating an erection. Then you slide a tension ring onto the base of your penis to trap the blood and maintain the erection. It sounds a little mechanical, I get it, but these devices work. They have a success rate of about 75%, and they're especially useful for men who can't take oral medications due to health conditions or drug interactions. Plus, vacuum pumps are one-time purchases, so they're cost-effective in the long run. Many of my patients who were skeptical at first have become big fans once they saw the results. Solution number 4. Low-intensity shockwave therapy. This is one of the most exciting advances in erectile dysfunction treatment in recent years. Also called acoustic wave therapy, this treatment uses sound waves to stimulate the growth of new blood vessels in the penis. It's non-invasive, painless, and has no downtime. You come in for a series of short sessions, typically 6 to 12 treatments over several weeks. The shock waves break up microplaque in the blood vessels and trigger your body's natural healing response, leading to improved blood flow. Research shows that shockwave therapy can be particularly effective for men with vascular erectile dysfunction, which is exactly what we're dealing with when blood pressure or blood pressure medications are involved. It's not right for everyone, and it's not usually covered by insurance, but for men looking for a drug-free solution with long-lasting results, it's worth considering. 5. Lifestyle modifications. I saved this one for last, but honestly, it might be the most powerful approach of all. The lifestyle changes you make can dramatically improve your erectile function and might even help you reduce your blood pressure medication over time. Let me give you the top strategies. First, exercise regularly. Physical activity improves circulation, strengthens your heart, lowers blood pressure, and boosts testosterone. Aim for at least 30 minutes of moderate exercise most days of the week. Cardio is great, but don't skip strength training. Building muscle helps with testosterone production. Second, lose excess weight if you need to. Obesity is closely linked to both high blood pressure and erectile dysfunction. Losing just 10 to 20 pounds can make a significant difference in both conditions. Third, eat foods that support nitric oxide production. Nitric oxide, remember, is the chemical that helps blood vessels relax. Foods rich in nitrates and antioxidants can boost your body's nitric oxide levels. We're talking about leafy greens like spinach and arugula, beets, watermelon, dark chocolate, nuts, and fatty fish like salmon. These foods improve blood flow throughout your body, including to your penis. Fourth, limit alcohol and quit smoking. Excessive alcohol can interfere with erections, and smoking damages blood vessels, making erectile dysfunction worse. If you're serious about improving your sexual health, cutting back on booze and quitting cigarettes are non-negotiables. Fifth, manage stress and get enough sleep. Chronic stress and poor sleep both mess with your hormone levels, including testosterone. They also increase inflammation and negatively impact blood flow. Find healthy ways to manage stress, whether that's meditation, exercise, hobbies, or talking to a therapist. And prioritize getting 7 to 8 hours of quality sleep each night. Finally, consider supplements that support vascular health. Things like L-arginine, L-citrulline, and pycnogenol have been shown in studies to improve erectile function by boosting nitric oxide production. These aren't magic pills, but combined with the other lifestyle changes I mentioned, they can definitely help. As always, talk to your doctor before starting any new supplement, especially if you're on medication. But here's the most important thing. You need to talk to your doctor. I can't stress this enough. Erectile dysfunction can be an early warning sign of more serious cardiovascular problems. It's your body telling you that blood flow isn't what it should be. So don't ignore it, and don't try to handle it on your own. Schedule an appointment with your doctor or a urologist. Be honest about what you're experiencing. Ask about the medication options I mentioned today. Get your testosterone checked. Discuss treatment options. The conversation might feel awkward at first, but I promise you, doctors have these conversations all the time. We want to help you. That's literally what we're here for. And remember, taking care of your sexual health isn't just about the bedroom. It's about your overall quality of life, your confidence, your relationships, and your long-term health. You deserve to feel strong, capable, and fully alive at every stage of your life. So take action. Don't wait. Start with one step today. Maybe that's scheduling a doctor's appointment. Maybe it's committing to 30 minutes of exercise. Maybe it's having an honest conversation with your partner about what you're going through. Whatever it is, take that step. If you found this video helpful, do me a favor. Smash that like button. It really helps get this information in front of more men who need it. Subscribe to the channel and hit the notification bell so you never miss a video. We're covering men's health topics every single week. Everything from testosterone and prostate health to fitness, nutrition, and mental wellness. And drop a comment below. Let me know if you have questions or if there's a specific topic you want me to cover next. I read every single comment, and your feedback helps shape the content we create. Thanks so much for watching, guys. Take care of yourselves, and I'll see you in the next video.
Prime Health Lab is dedicated to men's internal health. Don't forget to like, share, and subscribe.